afternoon to you, Mbali. Now, just give us some highlights from the Acting Health MEC's address earlier on and the importance of having a vaccine site opening on the weekends.
Okay, that's right. Of course, so we have seen the increase in those COVID-19 infections, and more specifically, when it comes to this province in Gauteng. Just earlier on, as Mmmoloko K was speaking, she basically just spoke about how serious the infections in Gauteng are, and how, as a national government, they will be sending in an intervention team to look into this issue. But at the same time, she was also here on this vaccine site inspection. It does now open its doors on a weekend, and this is specifically the one at the Baragwanath Hospital in Soweto. But just to tell us more about this, we are joined by the Gauteng Premier, David Makhura. Premier, the Health Minister, the Acting Health Minister, has painted a grim picture of the province and the increase in those COVID-19 numbers. But at the same time, I want us to begin where we are right now. We are at this vaccine site in Soweto, the first to open its doors on a weekend. Why was it necessary?
Yes, in our response to COVID-19 pandemic, the vaccination program is a very important pillar of our response. So increasing the capacity to vaccinate, including now using weekends to reach out to more people, is something that we have been exploring. So Chris Hani Baragwanath is the first site that is operating during the weekend. People have been asking, why is the vaccination only from Monday to Friday? As you would know, to be able to do a 7-day operations has a huge bearing on the logistics and the finances, but we had to look at it. So we are intending to ensure that we increase more sites that can operate and vaccinate people as well during the weekend, because vaccination is one of the critical things we have to do. As long as we receive vaccines, we want to get those vaccines onto the arms, especially of senior citizens in our province. The good thing is that we have reached almost 90% of our healthcare workers in Gauteng. 90% of them have been vaccinated already. We want the remainder of the 10%, we want them to come to the fore. We have vaccinated over 300,000 people over the age of 60 and above. But that, as you know, that number is nothing compared to the fact that we need to reach 1.3 million senior citizens in Gauteng. So all these measures, increasing the number of sites, we are increasing the number. In this coming week, we are going to add more sites and ensure that these sites are also located in the townships, in places where a lot of the elderly people live in Gauteng, and many of those elderly people in the townships would have difficulty with registration, and that's why on these sites they also mitigating that by ensuring that if someone has not been able to register on the EVDS system, when they arrive on site they get assisted to register on site. And if the vaccines are there, they get assisted. So the issue of walk-ins is something that in the province we have really been doing. We know, yes, those who are registered, who are there on the queues, who have been informed that that is their day, are not being neglected. Attention is being paid to them. But you can't not attend to walk-ins. It's almost impossible. You can't. Our healthcare workers know you can't turn people away. So vaccination is critical. The more vaccines we get, the better. But we know that with regard to the current third wave, the vaccination program will have an impact somewhere down the line. We need other measures to actually be able to slow down the current momentum of the third wave, and that's what we were discussing with the minister. She came to our province. At the moment, we are at the center of this ball fire. We are the epicenter of the third wave as Gauteng province. So we had a briefing session with the minister, like we did during the first wave and the second wave. When we reach this period, we also voluntarily go to the national department and say we need additional support in this area, we need additional intervention there. So we also today, I've been talking to the minister from during the week to say, Minister, we need a particular type of support interventions, and we worked out on those interventions. We also want to look as to the fact that level 2 people are not necessarily responding to the level 2 measures. So we also raised this with the minister to say that given the fact this week we reached a period, we last reached in July 2020 and in January 2021, where we exceeded 5,000 infections a day. So this week we reached that over 3 days. 2 of the 3 days we were over 5,000, and the last 24 hours 4,800, almost 5,000. So this is of grave concern to us, that the pandemic is now reaching levels. When we look at the hospitalization rate, the number of people who are getting admitted in our hospitals has also is 3 times what it was in April this year. We now have more 3,600 people who are admitted in our hospitals in Gauteng. In April, we had 1,200 people admitted in hospitals. So all those indicators mean something to us. We want to take extraordinary measures. Let's look at the environment, the behavioral environment. Let's also look at increasing the capacity of our healthcare system to look after the many people who are not just getting COVID-19, but they also now falling sick. It's not just about how many people are testing positive. The positivity rate is over 24% at the moment in our province, but we have more people who are getting admitted sick in the hospitals.
All right. Premier, coming back to the vaccine site, you have said that you are also looking at opening more of these vaccine sites. If you can just take us back, how many in Gauteng will you be willing to open? Have you identified which of those areas to target?
Okay, the original plan in our province was that, and it was based on the different phases of the national vaccination program, that we have the footprint of 2,400 vaccination sites. But as you would know, when we went to phase 2, we couldn't open all of them because of the availability of vaccines. At the moment, we have 140 vaccination sites, and the number is increasing every week. This is one of the sites that's doing very, very well. Krisani Baragwanath's site is doing extremely well. It's one of those sites that are doing well. But based on the number of vaccine doses we receive, we will be increasing. In the coming week, we are going to increase more sites and increase also those that are going to do vaccination during the weekend.
You've spoken about how the virus is raging in Gauteng and there needs to be intervention, and that level 2 is really not enough. What type of intervention is needed to bring down those numbers?
Well, firstly, we would like to make sure that the healthcare system is protected again. The team in the department will be giving a report to the National Department of Health on trauma, especially the trauma patients. We want those trauma beds, especially for incidents that have to do with trauma, that's where people, stabbings or shootings or accidents. We are reviewing that, and then we will send the numbers to the National Department of Health. We want to protect those beds. We also have received the report from our hospitals, in particular, that we have a lot of non-COVID patients. So unlike during the the second wave, where we had a lot of beds that were available for COVID patients, but we also have other patients at the moment. So everything is being done to attend to that, but we also have people who are called patients under investigation. In other words, it's people who it's not yet determined whether they are positive, they tested positive or negative, but they are waiting. They occupy a bed sometimes. So we also want to make sure that the testing is done. Antigen testing is something that gets used. We clear the PUIs out of our hospital. Patients under investigation, we only need those who are sick in the hospitals. But we can only do that by ensuring that the test results are known as swiftly as possible. That's why antigen testing is something that we have agreed in the meeting with the minister now, that in the province, that half of the patients who are in our hospitals at the moment, we've got 69% bed occupancy. Half of those are patients under investigation. And some of them are just waiting to know if they've tested positive or negative. So there's a different way of dealing with that by ensuring that the test results are known quicker so that we clear those beds. At the moment, our greatest worry is those who need care. Those who are sick, who need care, and we are coordinating with the private healthcare sector. They've got the same pressure. The private healthcare sector has got the same pressure. But we want to clear patients under investigation by using antigen testing. Other interventions,
I'm afraid I'm going to have to cut you there, Minister. Premier. Of course, the Premier, they're just giving us a synopsis of how the numbers in Gauteng are looking like at the moment there. Of course, he has said that it is raging. They need intervention. There will be that intervention that will be done by a national government, as well as looking at other avenues to look into, like that level 2 that we find ourselves in, saying that those living in Gauteng are not responding well and to those measures, and it seems as if it's quite evident there that those numbers continue to surge. It's back to you.
Well, thank you for that update. Our reporter there, Mbali Tetani.